Osteoporosis: the best treatment options. Osteoporosis causes bones to become weak and brittle, so brittle that a fall or even mild stresses like bending over or coughing can cause a fracture. Osteoporosis-related fractures most commonly occur in the hip, wrist or spine. Bone is living tissue that is constantly being broken down and replaced. Osteoporosis occurs when the creation of new bone doesn't keep up with the removal of old bone. Symptoms. There typically are no symptoms in the early stages of bone loss. But once bones have been weakened by osteoporosis, you may have signs and symptoms that include back pain, caused by a fractured or collapsed vertebra, loss of height over time, a stooped posture, a bone fracture that occurs much more easily than expected. You may want to talk to your doctor about osteoporosis if you went through early menopause, took corticosteroids for several months at a time, or either of your parents had hip fractures. Causes. Your bones are in a constant state of renewal, new bone is made and old bone is broken down. When you're young, your body makes new bone faster than it breaks down old bone and your bone mass increases. Most people reach their peak bone mass by their early 20s. As people age, bone mass is lost faster than it's created. How likely you are to develop osteoporosis depends partly on how much bone mass you attained in your youth. The higher your peak bone mass, the more bone you have in the bank and the less likely you are to develop osteoporosis as you age. Risk factors. A number of factors can increase the likelihood that you'll develop osteoporosis, including your age, race, lifestyle choices, and medical conditions and treatments. Unchangeable risks. Some risk factors for osteoporosis are out of your control, including your sex. Women are much more likely to develop osteoporosis than are men. Age. The older you get, the greater your risk of osteoporosis. Race. You're at greatest risk of osteoporosis if you're white or of Asian descent. Family history. Having a parent or sibling with osteoporosis puts you at greater risk, especially if your mother or father experienced a hip fracture. Body frame size. Men and women who have small body frames tend to have a higher risk because they may have less bone mass to draw from as they age. Hormone levels. Osteoporosis is more common in people who have too much or too little of certain hormones in their bodies. Examples include sex hormones. Lowered sex hormone levels tend to weaken bone. The reduction of estrogen levels at menopause is one of the strongest risk factors for developing osteoporosis. Women may also experience a drop in estrogen during certain cancer treatments. Men experience a gradual reduction in testosterone levels as they age. And some treatments for prostate cancer reduce testosterone levels in men. Thyroid problems. Too much thyroid hormone can cause bone loss. This can occur if your thyroid is overactive or if you take too much thyroid hormone medication to treat an underactive thyroid. Other glands. Osteoporosis has also been associated with overactive parathyroid and adrenal glands. Dietary factors. Osteoporosis is more likely to occur in people who have low calcium intake. A lifelong lack of calcium plays a major role in the development of osteoporosis. Low calcium intake contributes to diminished bone density, early bone loss and an increased risk of fractures. Eating disorders. People who have anorexia are at higher risk of osteoporosis. Low food intake can reduce the number of calories and amount of protein and calcium ingested. In women, anorexia can stop menstruation, leading to weaker bones. In men, anorexia lowers the amount of sex hormones in the body and can weaken bone. Gastrointestinal surgery. A reduction in the size of your stomach or a bypass or removal of part of the intestine limits the amount of surface area available to absorb nutrients, including calcium. Complications. Bone fractures, particularly in the spine or hip, are the most serious complication of osteoporosis. Hip fractures often result from a fall and can result in disability and even death from postoperative complications, especially in older adults. In some cases, spinal fractures can occur even if you haven't fallen. The bones that make up your spine can weaken to the point that they may crumple, which can result in back pain, lost height and a hunched forward posture. Tests and diagnosis. Your bone density can be measured by a machine that uses low levels of X-rays to determine the proportion of mineral in your bones. During this painless test, you lie on a padded table as a scanner passes over your body. In most cases, only a few bones are checked, usually in the hip, wrist and spine. Treatments. Treatment recommendations are based on an estimate of your risk of breaking a bone in the next 10 years using information such as the bone density test. If the risk is not high, treatment might not include medication and might focus instead on lifestyle, safety and modifying risk factors for bone loss. Lifestyle and home remedies. These suggestions may help reduce your risk of developing osteoporosis or experiencing broken bones. Don't smoke. Smoking increases rates of bone loss and the chance of experiencing a fracture. Avoid excessive alcohol. Consuming more than 2 alcoholic drinks a day may decrease bone formation. Being under the influence also can increase your risk of falling. Prevent falls. Wear low-heeled shoes with non-slip soles and check your house for electrical cords,